For part two of the Ask the Expert Endometriosis Patient Perspective session, we're going to talk a little bit about fertility. Professor George Condas, can you tell us a little bit about how endometriosis affects fertility? Will people with endometriosis still be able to have a baby?
Thank you, Matthew. I think the reassuring aspect of endometriosis is that the vast majority of women have mild disease. And if you do look at those with endometriosis, potentially 1 in 3 may have problems with fertility. So that means that the vast majority of women are likely to be able to have a baby. And in the group that find it difficult, they can then seek expert input from fertility specialists. Endometriosis can affect different aspects of your pelvis. It can affect the womb, so it can have an impact on the receptivity of the potential embryo that wants to implant into the uterus itself. The fallopian tubes, which carry the embryo back to the uterus itself or back to the womb, can be affected. So you can get mechanical obstruction of the fallopian tubes, which might make it more difficult to get pregnant in the first place, or may affect the ability to transport the embryo back to the uterus itself. And when you look at the ovaries and ovarian function can sometimes also be affected by the presence of endometriosis cysts or the presence of endometriosis. So endometriosis can have a global effect on a person's fertility and ability to conceive. But remember, the vast majority of those with endometriosis can still have a baby. Now, Matthew, I'm going to go back to you with a similar question. So often women are concerned that during their pregnancies, that there's going to be problems with pain, especially in relation to labor management and pain. What are your thoughts and advice in relation to this?
Thanks, George. Pain is a very challenging experience in pregnancy because there are lots of pregnancy changes that people have that are sometimes quite normal pregnancy changes that are uncomfortable or painful. So interpreting endometriosis pain in pregnancy is quite challenging. However, pregnancy has historically been known as a time when pain due to endometriosis seems to be settled. Lots of patients in their pregnancy do feel better, and that's due to the high levels of progesterone generally. There are still people with endometriosis who can have pain in their pregnancy. And in those people, we try to advise on typical pain management using things like acetaminophen or paracetamol, things that are known to be safe in pregnancy. But certainly we would suggest speaking with your obstetrician, gynecologist, midwife, and anesthesiologist looking after pain in your labor process.